In your last message, you asked for a smoother demonstration of how a therapist would be able to log into the Billing Dynamics system, view their daily schedule, and then complete the documentation and billing. So this morning, I hope to demonstrate that for you by recording those steps on my computer. There are ways to deviate from the process I show you here, as I don't know specifically what your intake process will be. There are different ways of changing this. Those would best be identified and refined during the onboarding and training process when you're working with our team to establish those policies and procedures so that you could refine this process to simplify it for any therapist that's working with you. So the first step of gaining access to Billing Dynamics is to log in. By going to the billingdynamics.com webpage, on the top of the menu bar, you'll see a button that says Login. By clicking that, you'll be brought to our portal. Once here, your therapist will be asked for their login, their password, and the office ID. The password is created by the therapist, though the system will provide them prompts when they're creating it to ensure that it is a strong password. And the office ID is assigned during the account creation, and that most typically is the office EIN number. In addition to these three steps, we also suggest that the office set up two-step verification. Two-step verification is provided by Google, and it really adds a whole nother level of security. The therapist would download an app onto their phone, and in order to gain access to the program, that app would generate a 6-digit code which would need to be entered at the time of login. The codes are randomly generated and they expire in a very short amount of time. So in order to really maintain HIPAA compliance, especially when you have people out in the field, we highly suggest you use the Google Step verification and link that to all of your logins. But once that information's been entered, the demo account doesn't have two-step verification on it. They would click login and they'll have access to the program. Once a therapist has logged in, they'll arrive at the Billing Dynamics dashboard. Now the view here will be specific to the person. It's highly customizable, and the information available is limited by their role inside the organization. So the regular therapist wouldn't see most of what I'm looking at on this page. They wouldn't have access to your macro data, they wouldn't have access to your financials, and in most cases you wouldn't even bother setting up the line graphs or charts that are on here. It just wouldn't be necessary. Most of this page would be blank, but they would have access to the quick links and to the workbench menus that you can see at the top of the page. So the therapist would log on to here and they click on schedule. Now we look at the schedule of Elizabeth for the day. Now this is very customizable in terms of what you see and how you see it. The duration, the times that are covered, the size of the schedule itself, and then the appointment types that are available and the colors and what they represent. So in this case, looking at Elizabeth's schedule, her afternoon is composed of 3 visits, and by virtue of the colors that have been assigned, we can tell at a glance what she's looking forward to. So in this case, with Lillian Richards with the red color, we can see that it's a reevaluation. With Tara Twist here, this gold color is a standard evaluation. This light blue, this is going to show us that it's a new patient. So again, she can tell that by looking before she even digs into it. So by clicking on the patient tab, we'll move into the patient's medical records. We'll go to the documentation tab and we'll see an accounting of all the medical records that are associated with that patient. So if you want to read up on them, you can do so. You can click on the note and generate the note and read whatever has been written about that patient prior. Now workflow is going to dictate what is done next. The therapist could check all the patients in once she's reviewed their documentation, prepared for their visit before heading out on the road. or they could be checked in from this page when the therapist arrives at the location. It depends on how you want to track that. It will really be determined by the workflow and policies that you establish in the organization. Now, when you check them in from this page, the system will automatically check to see if there are any alerts on the account. Alerts can be set up globally for the entire organization or specifically for any given patient. So in this case, if we check in the patient, it's going to check to see if there are any alerts. And in this case, there's some information about needing new authorization from the doctor. They have a balance, there's a copay due, they've missed appointments, they don't have a plan of care. Once they're cleared, you can move on. I think the easiest way to move forward would be to use the document and bill. So you would click on whatever documentation you want to use. Rendering practitioner, we've established, will be Elizabeth, who will be doing the note. We have the patients who are in the office and that have not been billed out yet. And in this case, we see Lillian, Tara, and Thomas. We can click on them. And generate the note. If there's been an earlier visit, the information will automatically be populated and pulled forward. So information will not have to be re-entered. The same will apply for the diagnosis codes and CPT codes. The only exception would be specific codes that are suppressed. For example, the initial evaluation code will not be pulled forward to the next visit for obvious reasons. You wouldn't want to accidentally bill that out 2 times in a row. So codes like that will be suppressed. So here we have the menu on the left, documentation in the middle, and then a real-time presentation of what the document will look like on the right-hand side. To save real estate, we can hide this right now. And if we don't want to see this, we can also hide the preview. So we only are using the real estate on the screen to collect information. Now again, on a real clinic, we would suggest that you upload your letterhead to the program so that your documentation has that visible. And that would be obviously up here. We would also suggest that any therapists inside the program upload a facsimile of their signature so that when they do sign off on the note, there is a visual representation of their signature on it, as opposed to just an electronic signature stamped on the bottom with the date. Just overall, the presentation is better. So again, for the purpose of this demonstration, we're not going to go into the nuances of this specific document, as you'll have other documents that are available to you to use. And if you wanted to, we have a team that could build you specific and customized documentation for your organization that would be unique to you. So the next step, once documentation is completed, again, codes could be selected from within the documentation during the documentation process. Diagnosis codes could be set up in groups with your favorites, so it would be easier for them to find. And it's a push button process in order to do so. As you'll see, as I click on the CPT codes, they are showing up inside the note. And just for demonstration purposes, I added a G code. When documentation is complete, the therapist simply clicks on the complete button, which will bring them to this summary page. 2 short notes about the nature of the documentation inside the program. The first is that you can create customized macros, full document macros. So if you're running into a similar condition with frequency, you could write out a note and open up the related fields, then save that with a title so that a therapist wouldn't have to start from scratch every time collecting all of the information. The system would also be able to pull intake information and goals from the intake form that could be sent to the patient beforehand by email or filled out on the mobile device by the therapist once they've approached the patient for the first time by using these pull buttons. And lastly, I think is most interesting is these quick macro fields, which again would give the therapist the ability to can certain phrases in those fields, so they could just click on these. I don't think they're populated, but you could create a list of these specific terms that you could just click into instead of having to type out a long form narrative in these boxes. You will see them throughout the document. And these are all shortcuts that'll just make documentation faster, but still keep it unique and distinct every time. Without going into the specifics of any one document, you will have the opportunity to use different documents, pick the one that works best for you, or if you prefer, we do have a team that can build these customized for your organization. The therapist would click on the Complete tab. They would review it. If they want to, they can double check their diagnosis codes and their procedure codes. Changes can be made to the specific visit from here. And when they're done, they will again hit Complete. And if it had been properly formatted in terms of selecting a service facility, earlier on, they would be done. Now in your case, doing home care, the service facility that would be selected would say home care. And the system has been designed so that when it sees that prompt, when it sees that name in the service facility tab, it will apply the patient's address. So the individual therapist will not have to re-enter that information. They'll simply be using the home care category of service facility, and the information will be pulled from the patient's account every time. And that's the complete process for the therapist. Once that's been completed, the patient will be removed from the unbilled roster here. If the note weren't signed off, we would still find them on the unsigned list. The claim will immediately be moving through the back end of the system. The claim will be created. It's going to be scrubbed, looking for errors and compliance issues. If there's a problem identified, it'll be sent to the billing team for review, or it'll be sent to the provider claim workbench for your office manager to look at. As you're becoming more familiar with the program, or depending on the proficiency of your therapist, we could also set this up with a pre-submission review so that any claim that is created before being submitted to insurance electronically is sent to the workbench to be reviewed by somebody inside your office, regardless of whether there are errors or not. That safeguard can be applied to everybody within the organization. It can be applied to everybody regarding specific payers, or it can just be applied to specific therapists, be they new or poor billers. But again, there are lots of ways to customize the safeguards and monitors inside the system to make sure that the coding is going out clean on the first attempt. Because if you want to be paid quickly, the easiest way to do it is to simply not send out dirty claims. And the easiest way to do that is to catch them before they go out. So that's a summary. That's the process the therapist would go through to log into the program, to view their daily schedule, and to document and bill a visit. It's a simple process for the therapist. Again, the back-end tools, the reporting tools, the monitors, the quality assurance tools, the task managers, all those things don't specifically apply. If you have any questions, please feel free to email me at thomasj@espoc.com. That's THOMASJ@ESPOC, or give me a call at 727-386-9497. Thanks, I hope this helped.